study is about Gail Park, 21-week pregnant, who rushed to the hospital. She was rushed after complaining shortness of breath. She had a miscarriage on her last pregnancy. The doctor were concerned and requested for an X-ray. However, Gail were very protective against it. It could harm the baby, which the baby is actually a perfect donor to her daughter Leah that has been diagnosed with leukemia stage 4. They detect a case of heart failure. On her last pregnancy, she had a peripartum cardiomyopathy. They were aware of the risk, but they have no choice because that's the only way, the fastest way to find a donor for her daughter Leah. Doctor suggests to terminate the pregnancy, but they both requested to wait for 3 weeks as their daughter could not survive if she doesn't get any bone marrow transplant by the next year. After that, she suddenly can't breathe and is profoundly bradycardic. The doctor is a pacer to help with her heart beating. Even with a pacer, she still experiences a dangerous premature ventricular contraction which can risk her life. The EKG result, it shows that the heart is deteriorating and require a surgery to place a device called IVAD to help pump her heart. Then Gail's heart no longer able to function on its own. Doctor need to perform surgery, otherwise they need to intubate the mother. The doctor come out with the last option, which is to do the surgery of bypass. It is extremely difficult, but after the surgery, the mother was saved. However, they tried to save both of them, but only Gail was saved.
The ethical question for this case study is, should savior sibling be allowed?
The fact that we gathered from the case study, Gail wanted to save the baby in order to treat her sick daughter Leah. Her son Sam was a perfect donor match to treat Leah. In order to save Gail Park, they need to undergo the surgery to place the IVAD in order to pump her heart. Leah had a stage 4 leukemia. From Gail's last pregnancy, she had a peripartum cardiomyopathy. Even after the heart medication and increasing the pressure, Gail still cannot breathing properly. By undergo the surgery of bypass, they have a very little chance to save both of the life. The doctor have informed Gail before the off-bypass surgery that he will prioritize saving Gail over her baby. Known facts, which is the question that we have from the case study, are: after baby is born, what are the potential short-term or the long-term effects that will affect the baby when having the bone marrow transplant? What are the chances for Leah to be cured after receiving the bone marrow transplant from the savior sibling? Is there any other alternative other than off-bypass surgery in order to save mothers and the savior sibling?
Gail Park, the mother, is deeply concerned with the well-being of her children. She embodies values of altruism, caring, and sacrifice, always prioritizing her children's needs over her own. The bioethical principles given priority for the mother are autonomy and maximizing benefits. Gail Park has the autonomy to decide to undergo a risky procedure due to her heart failures to save her baby. These decisions highlight her right to control over her own body. Additionally, by choosing to carry the pregnancy to term, Gail Park aims to maximizing the benefits by potentially saving Leah's life with the birth of savior baby who could be a bone marrow match. Moving on to the next stakeholders, the doctor in this case values compassion and wisdom in making clinical decisions. He aims to maximize benefits and minimize harms in his medical practice. To maximize benefits, the doctor tried his best to save Gail's life despite her heart failure during her pregnancy, understanding the crucial role she plays in her family life. He also considered the potential life-saving benefits for Leah, the leukemia patients, if the savior baby is born. To minimize harm, the doctors prioritize Gail's survival, knowing that surgical intervention she requires has a higher success rate compared to potential complications that might arise from intubating her during pregnancy.
From Leah's perspective, the value that she has are stability, love, and caring. This relates to bioethical principles such as respect for autonomy. Respect for autonomy means acknowledging Leah's right to decide if she wants to undergo treatments, including a bone marrow transplant, and her role in saving her mom. Leah, as an individual, has her own rights regarding decisions about her body and health. Other than that, is justice. Leah urgently needs a bone marrow transplant, and a savior sibling might be a potential match. Justice entails ensuring Leah receives a fair chance at survival, recognizing her right to equitable healthcare. For savior baby's perspective, the values are innocent, remembrance, compassion, and love. The bioethical principle is maximize benefit. The savior baby's birth could provide the necessary bone marrow transplant to save Leah, who has been diagnosed with leukemia. This principle emphasizes the potential benefits that the savior sibling could bring to Leah's life and well-being. The second bioethical principle is justice. Justice also applies to the savior baby, ensuring fairness and equity in their healthcare and overall treatment. The savior baby must be treated with the same respect and care as any other individual, with their well-being considered in the decision-making process. Therefore, the decision to have a savior sibling involves complex ethical considerations that require a balance of respect for autonomy, justice, and maximizing benefits. It is essential to approach this decision with compassion, ensuring the well-being of both Leah and the savior siblings.
Assalamualaikum and hi, my name is Alia. My part I will present about the statement and argument for the stakeholders, which is mothers, gay part, and the second one is doctor. The first stakeholder is mother, which is gay part. Statement is the baby's life is precious and innocent. Her daughter has reached stage 4 leukemia and required bone marrow transplant by next year, otherwise she will die as her cancer has progressed vigorously. She has tried to form pregnancy 2 times to save her daughter, Leah. If she has to terminate the savior baby and cannot find any bone marrow donor for her daughter, all the effort would be pointless. So the argument for this is Mrs. Kelly Park has a heart failure, so being a pregnant is a high risk for her to not survive. Then the chance for the savior baby even after intubating the mother are still low. However, the chance for the mother to survive through the surgery is high. She has a history of peripartum cardiomyopathy during her second pregnancy and she knows the risk that her decision. The second one is doctor. It is doctor's responsibility to try their best and to find the best solution to help save mother, save their siblings and the sick daughter's life, as both lives are precious and worth to save. If the mother does not have a heart condition that would risk her life, the doctor would allow the mother to try for a savior baby as it will help to treat her daughter, Leah, as the chance to finding bone marrow that are compatible are low, which are around 25% to 30% according to research. Then the argument for this is mother's life is the doctor's main concern. If any consequence happens, doctor will prioritize the mother's life as her chance to live is much higher if she undergoes the surgery compared to their siblings. And it is not solely doctor's decision on allowing the savior siblings, as the doctor's job is to save lives and improve the overall health of their patients. In this case, the mother condition is not suitable to bear a child, let alone a savior siblings in the meantime or the future. So, well, that's all from me. I will pass it.
Hi, so we're going to talk about the next stakeholder. So the next stakeholder is Leah, the daughter. As for the agreement about Leah, we have 4 and 8 teams. As for a 4, Leah urgently needs a bone marrow transplant because the chances of finding a match donor can be very low, and sibling donor is often the best match, allowing the survivor baby to survive offer a potential life-saving opportunity for Leah, whose chances of a survival are currently very low without the transplant. If the survivor baby is a match and the transplant is successful, the outcome could not only save Leah's life but also bring the joy to the family. As for the against, Leah will feel guilty throughout her life if her mother dies to deliver savior baby in order to save her from the disease. Leah also will feel guilty about her younger brother do not getting enough attention since her parents pay more attention to her. And lastly, Leah doesn't even mind that not getting treated, but she just wants to live in a happy family like a normal person. So the last stakeholder that we're going to talk about is a savior sibling, which is the baby. As for the argument of the savior sibling, we have 4 and also against. So as for the 4, the baby life is precious and innocent. Other than that, he can be a donor of bone marrow to his or her sister that had been struggled with the leukemia cancer. And the last one, he or she can be a bright child in the future. As for the against of the savior sibling, it against he or she concerned to take his or her sister to survive against the leukemia cancer. It also can affect his or her mental health in the future because of he or she felt their only purpose was to serve the needs of the terminated sibling. Other than that, he or she will feel injustice for himself or herself. And the last one, it will be a burden for he or she to go through their life in the future. So that's all for the stakeholders.
Let's move on to the last part of this presentation, which is conclusion. In the previous part, we have mentioned about some facts, argument, and so on regarding all the stakeholders involved in this case. And now I am going to justify the ethical question, which is, should the savior sibling be allowed? According to the ethical question, we have decided not to allow this savior sibling being born. We have choose our position as savior sibling in the first place because there are certain factors will affect the savior sibling in the future. First of all, the savior siblings did not ask to be born as a saviors to the other siblings because they know nothing about the reason behind he or she being conceived by the parents. Even though the savior sibling do not have any right to do the decision in the present, but in the future, it will give an impact to his or her life. Just not only the side effect of the medical interventions his or her went through, but in terms of his or her mental development also might affect it, since the savior sibling was born to become a compatible donor to his or her sick siblings, and this will become a burden and potential harm to the saviors.